Did you know that if you stabbed the brain directly, it wouldn't feel any pain at all? That's right. You didn't hear it wrong. The brain, despite being the control center of your body, can't actually feel pain. Why? Because the brain itself has no pain receptors. There are no nerve endings inside the brain that detect pain signals. The surprising fact is exactly why some brain surgeries are performed while the patient is fully awake. Imagine this. A surgeon carefully operates on a patient's brain. The patient is talking, listening to music, maybe even cracking a joke, and yet they feel no pain as the surgeon touches the brain. How is that even possible? The reason lies in the structure of the brain and the types of nerves it contains. The brain has no nociceptors, the special nerve endings responsible for sensing pain. But now you might be asking, if the brain doesn't feel pain, then why do I get headaches? Why does my head hurt so much sometimes? That's a great question. When you feel a headache, the pain isn't coming from your brain tissue, it's coming from the structures around it. Headaches are caused by signals from muscles, blood vessels, and the protective layers surrounding the brain, called the meninges. When blood vessels dilate or constrict, when neck and scalp muscles become tense, or when those protective layers get irritated, they send pain signals to your brain. That's what you perceive as a headache. So the brain itself stays silent, but everything around it can scream in pain. This is why conditions like migraines or tension headaches can feel so intense. It's not your brain that hurts, it's the environment around your brain. Similarly, this is also the reason why doctors can stimulate different regions of the brain during surgery without causing pain, but can monitor which areas control speech, movement, or other functions. In fact, brain surgeries where patients stay awake are designed so surgeons can avoid damaging important regions responsible for vital functions. During these procedures, patients might be asked to speak, move their hands, or identify objects while their brain is being carefully operated on. Let's go deeper. The outermost layers of the brain's protection, like the dura mater, are packed with nerve endings. When these areas are inflamed, stretched, or irritated, they send pain signals. That's why brain tumors, infections like meningitis, or a buildup of pressure inside the skull can be so painful. It's not the brain itself, but these surrounding tissues reacting. And here's another mind-blowing fact. When scientists study how pain works in the body, they often use the brain's own lack of pain sensitivity as a reference. The brain feels no pain, but it's where all pain is processed. It's like having a computer that can detect all errors in the system but can't detect damage to itself.